Those tests are essential for laying the groundwork for what's going on inside your neck or back or inside your body to determine what is causing or what is adding to the pain you have. Without those tests, your doctor's not going to be able to help you. How do you treat the problem neurologically? Well, oxygen. We use oxygen in our office. If you have neck or back pain, when you breathe oxygen and get treatment, it's going to increase the healing response. It's going to heal. Oxygen heals tissues. If you don't believe me, hold your breath. See how long you last. Won't be very long. Your brain also needs glucose or proper sugar. We have to run those tests to figure out what types of things you need. Do you need to be eating beef? Do you need to be eating chicken? Those tests prove that for us. Brain-based therapy revolves around the neurological treatment of the neck pain and the back pain, reconnecting the brain with the neck and back. How do we do that? Well, sometimes we use vibration therapy. Sometimes we use a laser beam on the neck or back. Okay? Or if you have nerves that are being pinched, causing back or neck pain, we may use spinal decompression therapy, non-surgical spinal decompression. That means without cutting or operating on you. It provides a slow stretch of the muscles, which fires up the spinal cord, increasing firing of the brain, which decreases pain. Simple, complex. Ask yourself 4 questions. 4 questions. How has your chronic neck or back pain affected your job, your relationship, your finances, your family? If you've had this condition for a number of years or months, I'm sure it's affected it. Number 2, what does it cost you in terms of happiness, sleep, money, loss of work at the job? What's it really cost you? Number 3, where do you picture yourself in 1 to 3 years if this problem isn't properly taken care of? Are you going to still be taking the pills? Are you going to still be taking shots? Are you going to develop arthritis in your neck or back? Most likely. Then you got a whole other set of problems on your hands. And number 4, what is it worth to you if we could literally improve that condition? Is it worth your time? Is it worth your effort? Is it worth putting in what it needs to be put in to treat this condition? Is it worth having the tests run to know what exactly is causing it? I hope so. That's really important. What do you need to do? Here's what you do next. You call our office, 271-6992. Call our office and make an appointment for our evaluation, and we're going to run 4 basic screening tests on you. Those 4 tests will tell me if you're a good candidate for this program or not. If you're not a candidate, we will not accept you as a patient. Absolutely not. We do not accept patients into our program if we are not absolutely certain we can rid them of their problems. Last year in this office alone, we treated 18,203 patients. We simply don't have time to work with patients that aren't willing to put in the time or the effort needed to get better, to change their life. When you call our office at 271-6992, we're going to send you a DVD as well about your condition. On this DVD, I'm going to tell you exactly how to treat your condition, what we're going to do to help you, how we're going to find out what's wrong, and how we're going to get rid of it. Go to our website, www.thechronicpainclinic.com. Again, www.thechronicpainclinic.com. On that website, you can listen to other patients of ours that have had successful treatment of their condition. There's videos of patients on there. There's typewritten stories that our patients have given us. We treat patients from Little Rock, from Kansas, from Missouri, and their stories are on there. Learn about them. Okay? If you're not serious and you don't want our help, if you're not willing to put in the time, don't call me. Don't call me. But if you want help, if you had years or months of chronic neck pain or chronic back pain, and all the treatments you've had up to this point in time just don't seem to be getting rid of it, you need to call us. We'll change your life. I'm Dr. Jeff Smith. I hope you have a great day, and I look forward to seeing you in the future. Blessings.
This is Terry Wright, right?
Yes.
And you had right side leg pain, you had a disc bulge herniation going down your right leg, right?
Yes.
When did that start? Originally?
3 years ago.
3 years ago, okay. So when it happened 3 years ago, what type of treatment did you seek at that point in time?
Chiropractic initially, and the treatments weren't working, so I decided to go the route of back surgery.
Back surgery, okay. All right. And then, so you had a surgery. So what was the outcome of the first surgery?
The pain went away initially, and that lasted about a year and a half.
Year and a half?
Then
Okay.
the leg pain started coming back.
Was it on the same leg too?
Yes.
Okay. So your options at that point were what? You could go another surgery if you wanted?
Yes.
But we decided we wanted to try some decompression BBT-based therapy, right?
Yes.
All right. So far, at this point in time, we finished your therapy. You're going through some rehab now, but what has your outcome been at this point?
The leg is much better. There's a little bit of pain, but nothing.
No sharp laser knife lightning pain shooting down your leg?
No, I was to the point initially where I couldn't move my leg.
Yeah. When you walked, I remember your leg would kind of slap on the ground too. You were losing a little bit of strength.
Right.
Okay. So we've avoided surgery basically at this point in time, right? And now you're doing some rehab to make it strong so it lasts permanently?
Yes.
Very good. All right. Have you been happy with your success so far?
Absolutely.
All right. Excellent. Thank you very much, Terry.
If you're sick of having pain and sick of living on pain pills, you can come see Jeff Smith at Smith Chiropractic Clinic. I called him up and made an appointment. Jeff took a couple of x-rays of me and studied my case. It was the most professional operation I'd ever seen. The place is wonderful, and I can't say enough good things about it. I don't know what I'd do without it.
We will design a wellness plan that's right for you. Call us today for an appointment.